And we're live. Welcome, Floodgate family, to our second edition of the Improving.Live, where we're going to be answering your questions. We're super happy to do so. Got Greg Schmaltz here today joining me. He's obviously here at Floodgate, been here a year, but has over 21 years of recruiting experience and industry experience specific to MedTech. We're lucky to have him. Both working at organizations, MedTech organizations, as an internal recruiter, running his own recruiting business, and now over the last year or so we've been blessed to have him here at Floodgate. So him and myself are going to shine some wisdom onto just really what's going on right now in the job market and hiring market here in MedTech. And to guide it, we're going to be really relying on you guys to drop your questions over. I believe it's on the right side in the comments. But while we're waiting for people to log on here, Greg, I wanted, as I mentioned, you've got 21 years. I wanted to open it up and just kind of get your take, if you know, and shed some light for us. If you had anybody on this call, what's one piece of advice that you would give, whether they're just getting started in their MedTech career, they're late stage in career, whether they're actively looking for a role, or maybe they're happy right now and they're looking? What's one piece that you've seen true that everybody on here that's viewing it now and viewing it in the future could use?
You know, I think it's important to stay prepared. I know a lot of people get caught by surprise with a layoff or, unhealthy company, things go wrong. It's important to stay prepared. Keep your resume updated, keep your network active. File all that documentation of success, keep that filed. You wake up to a layoff phone call and all of that documentation is gone, right? That gets eliminated ASAP. So keep up to date your file of accomplishments, because a lot of companies want to see documentation, and stay prepared. There's nothing wrong with passively keeping an eye on the industry and, even passively, maybe even talking with some companies to learn and see what they're doing and what's going on out there. Understand your worth, your value, keep an eye on salary guides, like the one that's on our website. Just stay prepared. Something happens, then, it's always, number one, it's always better to look for a job when you're employed. So you're not defensively looking for a job and reacting.
Yeah. Well, and especially in today's market, Greg, I mean, you were talking about layoffs. We've obviously seen tons of those, right, across the industry. But the uncertainty, I think that unfortunately, the days of starting with one company at, age 25 or even 30 and staying there and never having to look for a job again, I don't want to say they're gone. I hope they're not gone, but it's fewer and farther between, and people are leaving, even when they don't want to leave companies, right? They're having to get on the job market. So what we see, and I've seen, and I'm sure you could time to this, is folks that have been 5, 10, 15 years since they've looked for a job. They haven't had to look, right? And it's like anything else, it's a skill. So if you're not both keeping all that documentation and knowing your value, but then also just keeping a pulse on the market. I mean, there's nothing wrong with, if you're happy in a position, and I'm sure you'd agree, taking a call from a recruiter or a company and just, hey, worst thing that could happen, I always say, is you find out you're in a good spot and that opportunity is not better, and that makes you feel good too.
100%. There's nothing wrong with learning and being aware of what's going on out there, especially with other companies and other opportunities. The companies, they're constantly evaluating talent as well. It's a two-way street.
100%. So, and everybody, just a reminder, just over on the right side, we're going to start answering some questions here in a sec, but drop in questions and we're answering them live right here as you ask them. So first, I actually see two questions in here on compensation. So I'm just going to pick Sarah's one, but there's one from Jill as well that is pretty good. Should I share, and we get asked this all the time, and so I really like this one. Should I share my current compensation during the interview process? And I would probably add to that, how do I go about properly navigating sharing my compensation during the interview process? So what's your take there, Greg?
I believe in transparency, honestly. I think it's important to be honest about that type of thing. The key is to know your worth, know what your value is. And yeah, if you're only making a certain amount and it's lower than what you should be making, in your opinion, have, concrete understanding of what your worth is. And that's what you tell them you need, in order to take a position. So be prepared that way. The whole transparency thing, some people will try to hold their cards close to the chest during an interview process. And, I have had clients of mine ask me, what are they making? What kind of money are they making? And when I have to say, well, unfortunately, I was unable to uncover that, they weren't forthcoming with that, instantly, there's a little bit of a turnoff by the client. It's like, hey, can I trust this person? Are they going to be genuine and direct with me and honest?
Right.
And so there's instantly a little bit of, lack of trust when people are holding their cards too close to the chest. It's better off to be transparent. Hey, this is what I'm making. It's not enough. I know what my worth is. I know I should be around this amount. And does this position have the opportunity to make that? If so, then let's talk. If not, then it's time to move on.
Yeah, totally. Well, and in such a competitive market with some of these positions where they've got 3, 4, 5 candidates that could all do the job, and you're late, early or late in the interview process, and sometimes it sounds crazy, but it could be that little thing of you're vague in the compensation area, and that loses a little bit of that trust, and they end up going with somebody else over you. So I
Yeah.
think, to your point, being transparent, being genuine, while also understanding your value and where you should be in the market is huge. And we've got a follow-up question, I think, to that. And from Sarah, another Sarah here, how do you navigate understanding your value in states that don't necessarily have salary transparency laws? So what's the best way to go about, hey, I am a sales rep or I'm an engineer, and maybe it's my first job, maybe it's the only job I've ever had, and I make X and I've gotten, a 2% raise year over year, but I don't know what anybody else is making. How do I go about navigating that, Greg?
Yeah, if the data's not out there, networking is, number one. Keep your network tight. Have those candid conversations with the other salespeople out there or other employees out there in your field, and talk to your recruiter. I mean, if you have a recruiter that has a little bit of time in their industry and they're focused, and they've been there and they understand the business, they'll have an idea of what the standard individuals are making in that space, and they should be able to consult you as far as income. And on the flip side, if you're somebody who's making a lot of money and you're worried about disclosing that because a company might not consider you because you're too expensive, well, you're just going to have to speak to the logic of it. Like, yeah, I'm making this amount. It's good, but frankly, that's not the number one most important thing to me. You got to focus more on career progression, really have a good understanding as to why you would take maybe a pay decrease for that position, maybe opportunity for advancement, progress your career. I've known many top salespeople take significant pay decreases to go into leadership. It makes sense because it advances their career. Otherwise, they get stuck in that sales role.
Yeah, and I think, and you touched on it earlier, we obviously biased here, but we have our salary guide that we release every year that has roles from associate sales rep through director of engineering through CEO and everything, and that's shows both the range but then the average market value. So that, of course, isn't a Bible, right, by any means, each industry, but it at least gives you an idea of where the market is at and how you can position yourself.
It's a good guide, and there's other salary guides out there as well. So if you just do your research, you'll find some information.
Yeah, and networking, like you said, is great. So
yeah.
I've seen a few questions. I'm going to pick Carly's, but I think Jacob and Conrad also had a similar question. Any advice for an entry-level sales rep seeking to move into the med device or med tech sales industry besides sales experience? What else can help them stand out as a candidate? We hear questions like this all the time, both from the companies looking to hire people in those entry-level roles. What should they be looking for? And then both candidates looking to break in. What should I do to sort of set myself apart in a competitive industry? So what's one or two bits of nuggets you think there, Greg?
Sales companies, and they're always looking for successful people. So, you definitely want to stay on top of your own success, why and how you've been successful. That's really important, thinking strategically and being able to show how you've been successful and how you've created your success. That's really important when presenting yourself as a salesperson, for sure. And then knowing yourself, understanding, you shouldn't be looking for a job if you're not 100% sure what you want, right?
Yeah.
So you should have a needs list and a wants list. And when someone goes into an interview and they firmly understand what their needs are and what their wants are, they come off very prepared, totally ready for the next step, and astute on what exactly is next for them. And if those things align, then it works out very well. But if they don't align, let's save everybody some time and
Right.
focus on finding something with that needs list, that short needs list.
Totally.
That's important.
Yeah. And I think the other, I love all that, Greg. I totally agree. I mean, understanding what you want and then what the company is offering and making sure those align, you don't want to just take any role, is important for longevity. But then also, I think, and we could go on, and we've done series in the past on Improving.Live about the importance of networking. And it's a word that, the word networking gets overused and sometimes is intimidating, especially if you're earlier in your career and you want to break into med device and you don't know anybody in it. Networking doesn't necessarily mean just chatting with your friends and trying to get a job through your friends, right? It's leveraging websites like primarily LinkedIn to connect with, even if there's not an open job. If I see a med device company that I'm interested in, or an industry or sector that I just want to learn more about, reach out to sales reps, to regional managers, to VP of sales, and don't be afraid to ask for, use the H word to ask for help. Because what I think you'll find is, especially the later folks get into their career, the more they've been helped and the more likely they are to, maybe they don't have a job for you, but they'll have a conversation. And then you, of course, come in prepared and show that you're a quality individual and quality candidate, make a good impression on them. And then that's how the network starts. The web, their friends' old boss might be hiring, and they're looking for a good person, and that's how you get in. So having more and more of those conversations and making more and more of those connections, both with companies that are hiring, but companies that even aren't hiring sometimes, is super valuable alongside applying for roles and going through it the more traditional route. Would you agree, Greg?
Oh, 100%. Knowledge is king. And the more you talk with people, the more you know. And people like to help. People like to share knowledge. So if you're especially young in your career and either trying to break in or looking for that next step within the industry, those individuals who've been in the business for a while, man, they love to help, man. They love to show their knowledge. They love to help. People love that. Even if they don't know you, people will take a 5-10 minute call, if you ask.
Definitely. All right. So this is something I think, thanks for the question, Thomas, here, that you had brought up as you were talking a couple of questions ago about tapping into a recruiter network. This is a really good question, because before being in recruiting, I truthfully didn't even know there were recruiter networks. So how would you say one goes about, whether they're actively job searching or not, finding and tapping into a recruiter network, or whatever you want to call it?
Well, yeah, great question. I mean, 100%, get referrals, talk to those people that you respect and trust in your network, find out who the recruiting firms they would recommend, and then talk with those recruiting firms and find out who has your best interest in mind. Find those recruiters who are focused on, helping you advance your career, opposed to making a quick dollar for themselves. There's a lot of different types of recruiters out there. So, and you have to be careful who you work with. A recruiting firm is kind of like an accountant. You know what I mean? I go to the same accountant every single year. I trust him.
Right.
He does a good job for me. And, with a recruiter, that's a sensitive subject, your career, and you want someone you could trust that, it has your best interest in mind, for sure. But how do you find that person? The best way is through your network. I mean, you can always look it up on Google, right? You can find anything on Google, but try to find someone local to you, because a lot of recruiters work regionally. And so try to find someone local and ask around.
Totally. And our obviously FloodGate, you're in the right place if you're here, so definitely reach out to us. But we'll be the first to tell you that you should network with many more, because we don't, unfortunately, not yet, we don't work with every single med device manufacturer out there, or med tech manufacturer out
Well,
there.
what you'll do is narrow it down to one or two. You'll find you'll end up finding a couple that have your that know the industry well. They got
Yeah.
their finger on the pulse of the business, and they have your best interest in mind. So you'll end up over time narrowing it down to one or two that you really like.
Totally love it. Perfect. I just had one here. This is a different one, and I'll be interested to hear your take on it, Greg. Any recommendations for an international student who is actively looking for an entry-level R&D job? Or this could go for sales roles or quality, any sort of role with MedTech. Because, and I have heard this, and I've got a take on it if you don't first, Greg, is sponsorships have died down. And so if they're international, they've got 4 years or 2 years or 6 years of education here in the US, they want to stay. But how do you go about finding and navigating that with companies that, or finding those companies that will sponsor you to stay here in the US?
That's a tough one. The larger companies are more open to that. I would focus on some of those, the larger industry competitors, because they have programs where they take interns, starting as an intern. I mean, we have interns at FloodGate that are now, or were interns that are now with us 5-6 years and super successful. So I think internships are great. And a lot of companies enjoy having an international student with different perspectives.
Yeah, definitely.
What are your thoughts?
Yeah, it's an interesting one because I don't think there's one true answer to it. I think your hit the nail on the head rather on the larger organizations are going to have a little bit more of that financial spend and incentive to spend that money on the visa. So I would gear towards there. It is definitely more common to do in the R&D side. The biggest thing that they're going to look for, and that you, Karen, hopefully I'm saying that right, are going to have to position yourself, and this goes back to what me and Greg were talking about earlier, is they're going to need a reason, right, for that sponsorship and to take the chance on you. So really hone in those skills. If you're still in school, like you said, get an internship, is you need to have a clear and defined reason of why they're going to take that chance on you, and be able to show that value and say, hey, I have XYZ skill that you're not going to get elsewhere, or it's going to be very hard to find elsewhere, and make it so they'll do whatever they need to do to get you on board, whether it's a visa, whether it's, any other route that they need to go. So I think just understanding your value and how you can fill their needs.
Yeah, the larger companies have programs set up for that, where they're out actively looking for international talent for sure, and they have those programs set up.
Yeah, love it. Perfect. I think, sorry, I was just a lot of questions and comments here, so I appreciate everybody. Thomas, here again, another one, and we've danced around this, but I guess it's a little more of a direct one. Once I've exhausted all the openings on LinkedIn, Indeed, ZipRecruiter, wherever you're going online, what's the next step I take? Or I guess even a better way to say this are, what are the steps to take right as I'm kicking off my job search, whether I'm employed, whether I'm unemployed, and I want to go out there? What would you say are those first couple steps, Greg?
Obviously, if you're looking for a new position, obviously, gather your documentation, get that resume updated before you even start poking around. Get your resume dialed, have your documentation, ready and available. And then again, start with those recruiters that you trust and your network. We place a lot of people every year, but we also see a lot of people getting jobs on their own through their network. They happen to know somebody, and we happen to have a position. I mean, really stay on top of your network and be transparent.
Yeah, I think it's 81 or 83% of roles at all level are filled by one's own network. Unfortunately for us, but that's the truth. So spending, I say probably 75-80% of your time, at least early on, should be, the whole time, but especially early on, should be going after your own network. And don't be afraid to ask for help, even if it's somebody you haven't talked to for 5 years, right? Because think about it
Or at
that
all.
way, is you would probably help someone else, so they'll help you. So spending, can't stress that enough, spending as much time as you can on your network. And then obviously LinkedIn, Indeed, those things. One other thing beyond, like we were talking about earlier, not just your own network, but if you see a job on LinkedIn or on MedReps and it's with XYZ organization, find out who the potential hiring manager is for that role and try and network and connect with them or people around them to then get ideally a referral to that position rather than having to go down the hole of Indeed or LinkedIn. Those places have their have their place, but if you can get to that decision maker, especially if you're talking about a commercial role or a sales role, it's going to increase your odds. So
yeah, that's one of the great things about a platform like LinkedIn is, you submit a resume. We've all been there. You submit a resume and it goes into a black hole. You never hear anything. Oftentimes these really large companies are receiving thousands of resumes every single day. So yeah, go ahead and maybe submit that resume, but really get on LinkedIn, find out who those VPs are in the area, and reach out to them. Absolutely. I think that is probably better than just submitting a resume.
100%. I mean, even if it's not the hiring manager this year, what I've seen, I don't know, you could even connect, and more often than not, with if we're talking about a sales role, with an existing sales rep and make a good connection with them, and they can refer you to the position, and then they have a financial incentive to do that. So,
well, 100%, a 5-minute conversation with a salesperson at that company, that conversation goes well, that salesperson is going to reach out to their boss and say, hey, this person's great, could be great for that position.
Yeah, love it. So going back, thanks again for the question there. Going back to what we were talking about earlier, entry-level roles, right? We're talking about how to break in. It's difficult, right? So a lot of times I think people think, hey, I don't have the luxury of being choosy on the type of organization that I'm going after, that I'm going to take a job with. So Tyler asks, your thoughts on finding that right fit for an entry-level med device sales job? Does it matter, or am I just trying to get my foot in the door and, I can see some red flags at the company. I don't necessarily like who I'll be working for, but they're giving me a job. Do I just take it? What are your thoughts on that? I think that's a really good question.
Yeah, well, a lot of that depends on your circumstances. If you're desperately in need of a job, then you might need to take that position with that sort of B company, if you will, that has red flags, right? It's experience. But if you have time on your hands, you're employed, and you may not like your current job, but you're employed and you're getting paid, well, then take your time. That's when it's time to make your needs list. Should only be 3 or 4 major needs, and then your wants list is going to be much longer. So you're not wasting anybody's time and or your own, and ask those questions that make sure that position fits your needs to begin with. But take your time and figure out really where you want to be, and the best way you're going to do that is just by doing research in the industry and talking to people within. So again, I think networking is key, and understanding what you really want to do and why.
Yeah.
Not just because somebody told you, oh, go into medical sales, it's great. No, you have to understand, why do I want to sell to doctors? Well, why do I want to sell medical technology? Why do I want to be in the healthcare industry? I mean, you're answering those 3 questions when you're asked, why do you want medical sales? Right? You should have it broken down, have an understanding.
Yeah, no, and that'll help you also in the interview process, right? Is understanding those things, because inevitably they're going to ask, why do you want to break into med device sales? And because I heard you can make a lot of money isn't the best answer to that,
Or because I want to help people. A lot of people say because I want to help people.
Yeah,
but if you're interviewing that's great if you're interviewing for the nursing position. But if you're interviewing for a sales position, you have to show not just wanting to help people, but also why is that industry? Why is that call point? Why are those products, morally rewarding products, right? Having a chance to talk with doctors every day, and that's who I'm mingling with on a daily basis. The industry being a recession-resistant industry. I mean, there's many good reasons why you want in. So you just got to peel that onion back a little further and dig a little deeper in your logic and your reasoning.
Yeah, and I think to your point, Greg, having that needs list is huge. Understanding what you're looking for and non-negotiables, right? You never want to take a role where one of your non-negotiables is compromised. But I do think, Tyler, you make a good point in you it might not check every single box when you're looking to break in, right? I mean,
Yeah.
there's some concessions you might have to make. I know, like an example, for instance, is a lot, an entry point for some people I've seen into medical sales is taking a role like in trauma or that's on call. Maybe that's not your end goal in 10 years when you have a family and kid is to be on call 24/7. But it's an entry point. You're looking to get good experience. You're looking to show you're a hard worker, taking a role that's on call for a short term to know the long term gain. That could be something that you make a concession on.
Absolutely. Early on, your needs list is going to be a lot shorter
Right.
than later on in your career, right? So it's easier early on. You could take that position that might have some red flags, but if it gives you a year of experience in the operating room or a year of experience, working with doctors on a daily basis, I mean, that's going to be valuable to another company.
Awesome. Great question, Tyler. So here's another one. I'm not sure who it's by or why it's not showing me who it's by, but whoever it is, thank you. What's your opinion on follow-up with recruiters regarding positions they're considering you for? Unfortunately, a lot of times recruiters don't get back if you're not the right fit before any process were to begin, and you kind of get ghosted. Be curious to see our thoughts on follow-up. So and this is, I hear this all the time. Unfortunately, it's a industry of people that aren't always the most considerate of other people. We've seen there are a lot of good players, but as with anything, there's some bad players. So what would you say, Greg, to kind of rephrase this, is the best way to navigate that communication and relationship with a recruiter? So I'm make sure that they know my needs and wants and I'm heard and they're getting back to me and engaging with me, but also not being overbearing.
That kind of goes back to your selection of the recruiting firms you're going to work with, right? There's nothing wrong with, if you're getting set up for an interview through a recruiter, there's nothing wrong with asking that recruiter, hey, do you mind hopping on a call with me after the interview so we can discuss feedback? And then will you get back to me with feedback from them? I think there's nothing wrong with asking them that, and that's going to make them accountable to it if they tell you yes. So the better chance you hear back from them. I think the more open communication you have with a recruiter, the more responsive they're going to be, and the more they're going to feel the urgent need to make sure to get back to you with feedback and everything else, because you've been very communicative with them, and they want to repay that.
Yeah, and I think building semi a relationship with them, right, as best you can, because at the end of the day, they're still people. I mean, we pride ourselves in getting back and providing feedback and do that, but I know that's not always the case. So I understand where your question is coming from. But if you're able to build that relationship and there's care and there's trust there as best you can through an initial, screening call or conversation, that's also going to increase it, your it's just relationship with them and chance that they'll treat you more as they should treat you, but then also keeping them accountable and staying on top of them to follow up and following up with them as soon as you can. So
yep. And I ask all my candidates before an interview to give me a call afterwards, or let's schedule a time to go over the interview. And then if someone's missing those appointments or never calls you back after an interview, so you don't know what their feedback is, well, that recruiter is going to be less likely to feel that accountability and urgent need to follow up with you. And, so it's kind of a back and forth thing. Everybody has to treat each other with that respect.
Yeah, perfect. We've got time for a couple more quick ones here. So this is an interesting one from Sebastian. I like it. I'm going to rephrase it a little bit to make it more general, but he's greener in the industry. He has an interview with the VP of neuromodulation sales in Los Angeles for an organization. How does he prepare himself to show his knowledge of neuromodulation? So he's in late stages. He's talking to a higher up at an organization. He's not super experienced, so he doesn't want to, but he understands the industry, wants to make sure he comes across best. How do you prepare for those late stage interviews that might be more intimidating?
You're going to be taking a lot of notes and learning a lot through the process before you get to that VP. So have those notes with you, even if you're pulling them out of your binder and referring to them during the interview. There's nothing wrong with that. It shows that you're on top of it. You have your list of questions. But also, each person you interview, if it's the first time you met with them, you have to treat that individual like a first interview. You know what I mean? You may have already uncovered from the regional sales managers what they're looking for and what are the keys to success in their business and that sort of thing. But the VP may have some other ideas on that. So go back to those initial interview questions and find out from them firsthand. Hey, what are your thoughts on this? I know what so-and-so told me, but I'd love to hear it from you. And what are your thoughts on that? And so each new interview with a new person is like a first interview. So you have to really go in there, make that connection, build that rapport, and then qualify those needs, just like you did with the other people. You're going to get a lot of the same answers, but you might find some new ones and some more insights.
Yeah, and that's great insight. I mean, I definitely wouldn't overthink it. I think sometimes you get to that late stage and you think that the VP is going to drill you on stuff. More often than not, they're a little bit more broad strokes. I obviously can't speak to this individual case, but hey, I mean, you've been in the interview process likely for a long time now. Compile all your notes, all the questions you've gotten answered. Come up with it's still good to have good questions at that juncture. And I think you'll do great. So good luck with that, Sebastian.
And you'll have more in-depth questions because of everything you've learned in the process. Right. So you'll be able to pull out some of that clinical knowledge that you've learned and ask some more deeper questions. But if you're making it to the VP, there's a good chance there's you and one other they've narrowed it down to, and the VP is just a checkpoint. Hey, who do I like better? Oftentimes.
Mm-hmm. Well, he just replied to the comment saying he was referred to a colleague. This is actually his first interview with the company. So I guess that's sort of, you can take that with a grain of salt. But if it's your first interview, then you definitely don't need to feel like you're on product or anything like that. Just go in,
do your research. At that point, let's do your research. Make sure you understand why this is exciting to you and your career.
Perfect. So there's a couple questions about cover letter. What are your thoughts there?
Well, if you're sending a resume blind, right? Somebody doesn't know why they're receiving it, or you're just sending it into the black hole of their online, career site. I would put a cover letter so that they understand, what you're looking for and why. It makes sense. If you're working with a recruiter, I don't know if a cover letter is really necessary because you're going to, that could just be in an email sort of thing, what you're looking for and what you need. Here's a resume. So cover letters, have one on hand, have a good one on hand for those blind, resume sends so that they understand, why you're sending it to them and what you're looking for.
Yeah. I mean, I think they've definitely become more and more rare to see in my experience. I think to your point, if you're sending something over blind to somebody you've never spoken to and may never speak to, it doesn't hurt. But more often than not, unfortunately, they're not going to get read or spent too much time on, is the unfortunate truth, especially if you're going into an organization. So I think it's never going to kill you, but I wouldn't overthink it as like needs to be my absolute money maker. Otherwise, I'm not going to get the job. Would be my perspective.
I agree.
Well, we've got a few more here, but I know we're running kind of late on time. So I think and this will kind of segue us to finishing up here. I mean, and we'll reply to these comments here in the comments as we're done here, sort of retroactively. But we're going to be doing one of these once every 4-ish weeks. I think actually next month we're going to have Renee Chang and Morgan Mills talk a little bit more clinically more on clinical roles. Obviously, they'll be happy to answer any questions, but outside that as well. But that's most of the time we've got for today. Thank you for everybody for joining.
Thank you, Danny. Thank you, everyone.
This was a lot of fun, and we will definitely be back here within the next couple of months doing these. And if there are any questions we didn't get to, obviously we're going to answer them here, but feel free to just reach out to Greg or myself. It's just first name at FloodGateMedical.com or LinkedIn or whatever the easiest mode is. And we're happy to help you any way we can on more of an individualistic and personal level. But that's been it for today. Thanks to everybody for tuning in.
Yeah. Thank you, everyone.
Take care. Bye-bye.